Well, it falls to me to say a few words about Ignatian spirituality. Now, it wasn't long ago that I was in the clinic where I work, and I was chatting with one of our third-year residents, third-year internal medicine residents. It was the second half of the year, and usually by then, most third-year residents have an idea as to what comes next. They're going to enter a fellowship, or maybe they're going into hospital medicine, or they're going to work in a clinic. And so I happened to ask him, what's next? Where are you headed after the end of your residency? And he paused for a really long time. And then he slowly answered by saying, I have to stop. I have to stop practicing medicine. It's just become too much for me. A lot of things have happened. I've had a lot of powerful experiences, but I feel tired and I'm just not sure what direction to go into. And we chatted for a little bit longer after that. And as empathically as I could, I asked him, well, could you share with me what kind of reflective practice you've been processing with? How have you met each of these powerful experiences that you've had in the last 3 years? How have you let them shape you? What kind of reflective practice have you engaged in and day out? And he paused again. And then he said, if I'm honest, I really haven't reflected. I haven't stopped to reflect. I've just moved from one thing to the next and hoped that none of those experiences shaped me in an adverse way. And that brings me back to one of the first insights that I'd like to share. And that is medical school, and I think residency as well, is not merely about learning medicine. It's not merely about gathering clinical knowledge and polishing one's skills. It's not merely about learning how to diagnose and treat type 2 diabetes or infective endocarditis or stroke. It certainly is about those things, but it's also about learning about yourself as you learn about medicine. And so the task of medical school, as I understand it, is twofold. Learning about medicine and learning about yourself as you learn about medicine. Allowing the profound experiences that are coming your way to shape you in a healthy way, as opposed to putting you in a position where you become progressively more tired, more worn out, more dissatisfied with your choice of the healing arts. And this brings me back around to spirituality in general and Ignatian spirituality in particular. Spirituality in general, I understand as a description of the contours or the lines of our relationship with the transcendent, whether we call that transcendent God or whether we call that transcendent nature or connectedness or the force or whatever. Spirituality describes how we relate, how we connect to that which is beyond ourselves, that which is greater than ourselves. Ignatian spirituality then is a description of how we relate to God. And at its very heart is a conviction that God is in all things, that I can stop and reflect on my experiences, great and small, and open to an experience of having God in the moment. I can mine my experiences for deep meaning. Now, almost every spirituality, whatever it is, has some kind of reflective practice associated with it, affiliated with it in some way, usually more than one. And Ignatian spirituality has quite a number of reflective practices that have grown up from it, and that are deeply embedded in it. And we're going to engage in one of them over the remaining 20 minutes or so, 20 or 25 minutes. And this practice is called the Examen, Latin for examination, sometimes called examination of consciousness or examination of conscience. It's really a survey of our interior landscape. It's taking our eyes, our inner vision, and looking at what's happening within us and trying to name what is happening within us. the Examen, a reflective practice, something that will help us process the powerful experiences that are coming your way starting on day one of medical school and continuing for the rest of your life. And not only powerful practices in medicine, but powerful practices in your life. This is a reflective tool that can be used whether you're practicing medicine or not, but I think it has special meaning for those of us in medicine because day in and day out, our practice is open to watching individuals enter this world and leave this world and suffer and rejoice along that complete spectrum of human emotion. So why don't we engage this reflective practice so that you can get a sense as to what it's like and whether it might be a good fit for you. Clearly, it isn't the only reflective practice in the world, but it may be one that resonates with you, and it's certainly one that that has helped a number of medical students. It's certainly one that's helped me, and I'll say more about that at the end of our encounter. So, my invitation to you at this point is to get comfortable. And that may mean you remain seated in your chair. It may mean that you lie on the floor. It may mean that you lie in your bed. Whatever it takes for you to get comfortable. We're looking for you to inhabit a body position where you don't really have to fidget too much, where you don't have to worry about where your arms or your hands are or your legs are. You can just relax. That's going to be the key. So why don't we take about a half minute or so and simply find what that position is going to be for you so that you're more relaxed, you're more comfortable. And when you find that position, I'm going to invite you to close your eyes. That'll be the next thing we do. So let's take a moment and find a good position for relaxing. It will really help if you're relaxed, either sitting upright in a nice comfortable chair or lying down or standing on your head if that's helpful, whatever it happens to be. So why don't we begin our reflective practice with a quieting down and an attending to the awareness, the sensations that we experience within ourselves. That's a good way to move into a reflective space, into a more centered space, into a space of, we'll say, attentiveness to the interior landscape that is always present. But sometimes we may not pay as much attention to it as we might, as is fruitful. So I'm going to invite you in whatever attitude that you've decided to inhabit to begin with your feet. We're going to start with an awareness of your feet, and we're going to sweep upwards toward your head. But if you would, concentrate on your feet for a moment, your feet and your ankles, and simply become aware of the sensation of having feet, as unusual as that may sound. What do they feel like? What are you noticing? I want to pay special attention to their position and to any tightness or tension that you might experience there. If you encounter any tightness or tension anywhere in this exercise, my invitation to you is to try to let go of that tension. Try to consciously relax everything that we're going to scan or survey as part of this reflective practice that we call the Examen. So we're beginning with our feet, and we're going to very slowly sweep up to our ankles and then our lower legs, between our ankles and our knees. And again, as we do that, we're paying attention to exactly how they feel, the position they're in, any tightness, that may be in our muscles. We're going to seek to consciously, attentively relax them as we go. We're going to keep moving up from our lower legs to our thighs. Again, looking to relax in the position we're inhabiting now and releasing any tension that may be in those muscles. You probably know this. Our bodies tend to be magnets for tension and tightness. And a lot of the tightness occurs beyond our conscious awareness. When I become engaged or upset, or I'm concentrating over much, I may find my chest begin to tighten or my jaw begin to clench. And so we're looking to relax that kind of tension that often accumulates in our bodies over the course of the day. So we're sweeping up now from our thighs to our hips. Again, we're surveying for any position that's uncomfortable so that we can change it, any tightness that we experience so we can relax it. Relaxation is what we're moving toward to help us center in order for a more fruitful examen. So let's keep sweeping up very slowly from our hips to our torso, our abdomen, chest, again, looking to relax those muscles, to move into a position that permits us to simply feel supported by whatever is supporting us, whether it's a chair or whether it's the ground or a bed or a couch, whatever it happens to be. Let's keep sweeping upward. And we're going to move up to our shoulders. And now from our shoulders, we want to pay special attention to the back of our neck, the area of the trapezius muscle. This is an absolute magnet for tension and tightness. It will tighten spontaneously in stress, whether that stress is physical or emotional. And so we want to make sure that it's as relaxed as we can possibly make it. So we pay special attention to that area behind our neck, running from the back of our neck down to our shoulders, each shoulder, and we want that relaxed. And now let's sweep down into our arms. Just right down into our arms, heading toward our hands. Again, noting the sensations, relaxing the muscles as we go. Special attention to the hands. The hands, like the trapezius and like the jaw, often become tight without our necessarily being aware of it. We don't often become aware of that tightness until at the end of the day we wonder why our hands may be sore or our neck is sore or we have a tension type headache. So let's try to relax our hands and our wrists. We really want them in a position where we don't have to pay much attention to their position from this point forward. We want them nice and relaxed and in a neutral kind of position. Now, returning to our neck, we're going to begin to sweep up over the back of our neck and right up over the top of our head, and then down the front, our face and jaw. And we want to notice again the sensations in these areas and any tightness. Remember to pay special attention to the jaw. It is, again, one of the great magnets for tension and tightness in our bodies. And those of you who may need to wear a guard at night know that it's not uncommon for that joint to be tense and tight and clenched in response typically to stress or stressful situations. So we go ahead and relax that with special attention. And now we take a moment and allow the sensations from our body, from head to toe, to flood in. We become aware of sensations from head to toe. Just let them flood into your conscious awareness. And they'll flood in. Those, some may dominate more so than others, but let them all come in without filters. Simply let them flood your awareness for a moment. Now, as that's unfolding, I want you to, or invite you to, turn your attention, your awareness, to something that's always with you, but seldom noticed, and that's your breathing, the rhythm of your breathing, the constant rhythm of your breathing. Become aware of the in-breath and the out-breath for a moment. Simply watch it. You don't need to adjust it. You don't need to speed your breathing up or slow it down. I'm simply inviting you to watch it. Watch or follow the in-breath and the out-breath for a moment and notice something about those two. They're not quite the same. Normal respiration has a much longer inspiration than it does expiration. The phase of inspiration exceeds the phase of expiration. So just follow that in-breath and out-breath for a moment. Become aware of those amazing sensations that in fact are always there and seldom noticed. Always there, but seldom noticed. This is a metaphor for reflection, in fact. Always there, but seldom noticed. There are always interior movements coursing through us. We're always feeling something. It may be a fairly quiet movement. At times it may be a louder movement. Some of those movements we may greet positively and some we might greet negatively. But indeed, they're always there. We don't often turn toward them unless we cultivate some intentionality. And that's what a reflective practice, this one in particular and others, seek to do. Help us become more intentional about noticing what is always there, but seldom experienced. Every experience you and I have evokes something within us. And that something speaks to us about who we are and what we want. And a good reflective practice, a fruitful one, will help us attend to this as a way of becoming our best selves, ourselves most fully alive, ourselves most fully integrated or actualized, or however you would refer to becoming your very best self. So we're paying attention to the rhythm of our breathing at this point and noticing the in-breath and the out-breath, always there, but seldom noticed. One thing to notice at this point, and that is that you may be experiencing or allow yourself now to experience body sensations and the rhythm of your breathing and maybe the tightness and relaxation of your muscles and maybe some of the emotions or feelings that are moving within you at this point. You're allowing yourself to feel those, but you are much more than those sensations. That you have a conscious awareness that actually transcends, is greater than everything you're experiencing right now. And that's a key insight. That's a key awareness. You are not your feelings, although you have them. You are a conscious awareness. We might say a spirit consciousness that is aware of all that's happening within you. In a sense, you are spirit in the world, to use a phrase that I obviously did not create myself, but borrowed from a Jesuit theologian, spirit in the world. We are watching ourselves. We are watching our experiences. We transcend our experiences. So centered as you are right now, aware of the sensation of your body and the rhythm of your breathing, I invite you, with eyes closed now, to turn to the transcendent in your life. Now, for some of us, that transcendent we name as God. But if you're not comfortable with that name, or that's not consistent with your spirituality, then consider the transcendent perhaps with a small t instead of a large T. And that can be anything that you consider beyond yourself. Maybe it's a sense of connectedness in relationships, or a sense of nature, or all life, or whatever you understand as greater than you or beyond you. So my invitation to you now is to turn to the transcendent, whether it's with a small t or a capital T, whether it's God or some other way you understand the transcendent. And ask, in the case of Ignatian spirituality, God to reveal to you, to show you something from the last 2 or 3 days. Something from the last 2 or 3 days where you were most present, where you were feeling things most profoundly, whether that was consolation, whether it was something you would label as a positive experience, or whether it was desolation, something that you would consider a more negative experience. Whatever it is from these last 2 or 3 days that represents the place where you were most present, feeling things most profoundly, most strongly, allow God to reveal that to you once more. Now, perhaps it was a sunrise, or if you get up early enough, maybe it was perhaps it was a sunset, or if you get up early enough, maybe it was a sunrise. Maybe it was an encounter with a family member or a friend. Maybe it was a dream, or maybe it was you standing in front of a piece of art, or maybe it was you listening to music that was consoling you, or reading a letter, or an email, or text message, or tweet, whatever it happens to be. Allow something from the last 2 or 3 days that had an effect on you to begin to take shape in your conscious awareness again, so that you can see this experience one more time. Let's take a moment now over these next 30 seconds or so and just let whatever that experience was begin to form, or rather reform, inside your conscious awareness so that you can see it and re-experience it. Let's do that for the next 30 seconds. Now, as this experience begins to form once again in your conscious awareness, my invitation to you is find a way simply to welcome it. It may sound somewhat silly, but welcome it as opposed to resisting it. Invite it to blossom in a sense so that you can see it more fully. And even more importantly, feel it once again. Whatever it is probably has some affective component to it. Some emotion, or maybe several, tied to it. We want to allow those to come back into our conscious awareness, whatever they are. And we're going to try to do that without filtering them out. Filtering them out is a very reflexive thing to do, but we're going to try to let the experiences come right back into our awareness and notice what they are and try to name them. What is it that we're beginning to see, and what is it we're beginning to feel again? What are the affective movements? Is it joy? Is it a sense of peace, comfort, a sense of being held? Is it frustration, fear, anxiety? Perhaps it's a combination of those, but whatever it is that's attached to or coming from this reforming experience, allow it simply to come into your conscious awareness so you can feel it and name it. In Ignatian Spirituality, we believe that what we're shown, what the transcendent or what God seeks to show us, what immediately starts to form in our conscious awareness when we do this exercise, this spiritual exercise, is given to us because it enshrines, it captures something that is part of our core, something that we desire or hope for is usually embedded deeply in these experiences. Whether the experience is considered to be a positive one or a negative one, it somehow enshrines a hope or a desire. My hope or my desire. And so my invitation to you at this point, as you're holding this experience and noticing the swirling emotions and feelings around it, is to ask the transcendent, or God in the case of Ignatian Spirituality, what are you inviting me to see here? What are you inviting me to notice? What's the invitation to me embedded in this experience that has evoked whatever feeling it has evoked? So let's take a moment in silence and simply pose that question. What am I being invited to? As this experience has come back to me, as I'm tasting it again or seeing it again, noticing it again, what's the invitation for me? Is it an invitation to experience care, to know that I'm loved, to know that I'm held? Is it an experience or a call to healing? What am I being invited to by seeing this experience from the last 2 or 3 days? Let's quiet down for a moment and pose that question. Almost always the powerful experiences that we have day in and day out are powerful because deep within them is my desire to become my very best self and to be most deeply connected with God's self and others in some way. And so you can see the value of this kind of reflective practice as a way of my learning about myself, my giving myself an opportunity to become my very best self in all of my experiences. So we're sitting with that invitation. What am I being invited to see here, to learn here, to do here? If you were doing this experience on your own, you might find it really fruitful just to sit here and to rest, maybe for 15 minutes, 30 minutes, an hour. But because of the limitations on our practice today, I'm going to invite you now to find a way perhaps to express some gratitude for the gift that this experience has been to you. It's come back to you from the past. You're seeing it again, you're feeling it again, you're exploring it. Only appropriate for us to find a way to express our gratitude for its appearance once more, and what it's seeking to show you about you and what you really want. So we find a way to express our gratitude for the gift of this having been given to us, for the gift of this time of quieting down and reflecting. And as we express our gratitude for this moment, we allow the image that's been given to us to return from whence it came, so to speak. Let it return into the hands of the transcendent. Let it return into the hands of God. Imagine it's like a butterfly that has landed on the palm of your hand, and you've spent time with it, and now it's taking off, it's leaving. So allow the experience to move back into the realm that it inhabited before it was given to you to see once more. Let it go back. Let it leave. As it starts to move away from you, I want to invite you to return to an awareness of your breathing, the rhythm of your breathing, the in-breath and the out-breath. Return to an awareness, a steady awareness of that rhythm, that constant, ongoing rhythm. Just inhabit that awareness, that rhythm, in-breath and the out-breath. In and out. The experience of the examen that we've just engaged in is one that can be practiced in long form or short form. It can be adapted to your schedule, to your personality. My colleagues in the ministry team and I have worked with students who have managed to integrate this kind of experience into their daily practice. I know of a runner who actually engages in the examen as he runs. And in fact, I know of a dancer who does it while he dances. He does an examen as he dances. In fact, he sort of dances the examen, if you can imagine. And I know of a medical student artist who draws her examen. My invitation to you is, if this resonates with you, to find a way to adapt it to your life and to make it your own. And if it doesn't resonate with you, by all means consider other ways of reflecting. But reflecting you must do as a medical student, as a resident physician, and as an attending physician. You want to be reflecting in order to learn who you are and what you want. It'll help you unleash your best self in the practice of medicine.